Breast cancer is the most common cancer in women in the U.S., and HER2 positive breast cancer accounts for nearly 20% of all breast cancer diagnosis. Now, joining us to talk about this approach to treating breast cancer is Dr. Riaz, medical oncologist at the Oklahoma University Health's Stephenson Cancer Center. Good morning, doctor. How are you?
I'm doing very good. Thanks for having me.
Well, thank you for joining us. A breast cancer diagnosis and treatment can be overwhelming. Can you tell us about the current treatment options?
Absolutely. So, like you said, breast cancer is one of the most common kind of cancers. We have about more than 250,000 cases in United States. And I'm very excited to be here on behalf of Genentech to talk about breast cancer and to create some awareness about breast cancer. So HER2 positive cases of breast cancer, which is about 20% of all cases of breast cancer, is a cancer which is very common and we see it very commonly. And no two breast cancers are same. So the profile of each cancer is very different from the other patient, which may have a completely different profile of cancer, and their disease can behave very differently from one to other. The HER2 cases are typically very aggressive types of breast cancers, but lately, because of the advancement in all the treatment options, we are able to effectively treat this cancer with a combination of chemo and targeted therapies. So targeted therapies, as the name implies, target specifically the HER2 part of the breast cancers. And in combination with chemo, we are able to successfully treat a lot of patients, and a lot of patients are able to get cure from these treatments.
Now, every person has a different lifestyle. Can you tell us about your approach to creating the right treatment plan for each patient?
Sure. So, everybody is different. People have a lot of commitments in their day-to-day life. They have work to do. Time is always a factor. So typically, the breast cancer treatments take a lot of time to administer all these medicines. So in the past, patients will spend hours and hours of time at our cancer center, sometimes more than half a day, to get all the treatments. However, very recently, we are able to cut these times short from hours to 5 to 10 minutes by delivering the medicine as a subcutaneous injections. And one such example is Fesgo, which is a combination of two medicines that for years we did through intravenous route, and it will take anywhere between 2 to 3 hours to do those medicines. But now we are able to do those medicines as a subcutaneous injection, which takes about 5 to 10 minutes. So it interferes very little with their day-to-day life. It does not cause any time constraint on the part of the patient, and very little commitment as far as time goes is required on the part of the patient. So in this way, we are able to interrupt their daily life as minimum as possible, while at the same time we are able to treat the HER2 positive cancers very effectively.
Now, what are the most critical things breast cancer patients should know when beginning their treatment journey?
So every breast cancer patient should know the detailed profile about their cancer. Like I said, no two cancers are same. So it is very important for every patient to know what is their hormone receptor status, what is their HER2 new status, and the positivity or negativity of these receptors can influence their treatment options. And we always have more than one treatment option available for any given type of cancer. So it is very important to know all the options that are available out there, and that requires a very frank discussion before getting into the treatment with the treating doctor as to what are all the options out there. And there are more than one option for every type of cancers, but each option has its own set of pros and cons. So every patient has to know all those options. They have to know what is the upside and downside of each option so that they can make an informed decision about their health and about their treatment plan.
Now, Dr. Riaz, where can we go to learn more?
So there are a lot of online resources where patients can go and get more information about breast cancer. American Cancer Society has a lot of information. They can also visit www.fesco.com, and that have a lot of information, especially for the HER2 positive breast cancer. Patients can learn about what is a HER2 positive breast cancer. They can learn about the treatment options, and they can learn about the side effects of all the treatment by visiting these websites.
Dr. Riaz, thank you so much for joining us on Morning Blend. Thank you.
Thank you very much.